Welcome to the 2020-2021 participant overview for the Health Plan with HRA. I'm Katherine Johnson from Lighthouse Group. As we do each year, let's begin by taking a look at the national trends for healthcare in our country. Since 2009, we have seen a 54% increase in family premium. On average, that's about 4 to 5% per year. In the last 5 years alone, we've seen a 22% increase in the family premium. This is by far outweighing and outpacing inflation and workers' earnings. Specifically for Miller-Johnson, we have seen a 46% increase in the prior 5 years. However, this has slowed dramatically in the last 3 years since implementing the HDHP, the High Deductible Health Plan. For the 2020-2021 plan year changes, we will continue with one plan option, the High Deductible Health Plan. We have some small changes in the medical plan design. The deductible will remain at $1,500 per individual and $3,000 per family. The network benefit percentage will change to 90%. That means that the plan pays 90% of your eligible expenses after your deductible is met, and 10% is paid by the participant. Your maximum out-of-pocket limit will change to $3,000 per individual and $6,000 per family. All other plan design features and coverage will remain the same. On the screen are the biweekly employee contributions for 2021. You'll see in the middle the current biweekly cost sharing, and in the bottom in blue, the new 2021 cost sharing. There is a slight decrease in the employee cost sharing per pay. These rates here are shown for full-time employees. If you're part-time, your employee contributions are prorated based upon your status. When you enroll online, you'll see your individual rates if you are part-time. Your health plan has two components: your health insurance coverage, which provides the insurance coverage for your medical and prescription claims, and your health reimbursement account. This provides a vehicle for Miller-Johnson to help you pay for your medical expenses. Together, they make your complete health plan. We'll begin by reviewing your health insurance plan through Priority Health. As a reminder, your spouse and your dependent children are eligible for the health plan along with yourself. A spouse who is eligible for medical coverage through his or her own employer and are full-time employees must enroll in that medical coverage for primary coverage. If your spouse enrolls in this plan secondary, the primary payer will be his or her medical coverage through his or her employer, and this plan will be secondary. This provision does not apply to your spouse if they're employed part-time, and it doesn't apply to dental or vision coverage. Generally, your children are eligible for the medical coverage until they reach 26, and this is regardless of any other eligibility for group coverage. Dental and vision coverage for children beyond age 18 requires documentation of your child being a full-time student. Each coverage is individual and is very specific, so please be sure to review the terms outlined in our summary plan descriptions and see Human Resources if you have any questions. The basics of your health insurance plan include meeting your deductible, your copay and coinsurance period, and your out-of-pocket limit, which caps your expenses for each plan year. Most covered services are subject to your deductible. If you have single coverage, you cover the first $1,500 of expenses. If you cover dependents, you cover the first $3,000 of covered expenses. A reminder that if you have more than one dependent, you along with your dependents, can each help to satisfy the family deductible. One person could satisfy it in full or a combination of your family members. Some services don't apply to the deductible. This includes preventive health care, certain drugs and medications, pre- and postnatal visits, and birth control services and medications. Your deductible accumulates from September 1 through August 31, and as a reminder, dental and vision services don't count towards your deductible. Certain medications are not subject to the deductible. You'll have a copay for these drugs without having to satisfy the deductible first. The drug must meet the criteria as preventive according to the IRS. By definition, it's a drug that prevents a condition or prevents a condition from getting worse. Not all drugs in the categories are eligible for the waiver of the deductible. The list is subject to change. Please see Human Resources for a listing of these medications. Some examples of the medications that are preventive include asthma, cholesterol, diabetes, heart conditions, mental health. This is a small list of those types of medications. See the full list for information regarding a specific medication that you might be taking. Diagnostic medical services generally always are subject to your deductible. This includes office visits for illness or injury, lab, hospital, emergency and urgent care, mental health services, rehabilitation, chiropractic. These services generally are covered after your deductible is met. They are covered 90% and you cover 10%. Some limitations do apply, and some services do require a pre-authorization. Remember to show your ID card even if your coverage is in the deductible period. This is how your provider knows to bill Priority Health so that you get credit on your deductible. After you've met your deductible, you'll either pay a copay or have coinsurance for your medical services. Your prescription drugs will have a copay, and emergency room also has a copay. The copays noted here have not changed, and your emergency room copay has also not changed. You have $10 copays for Tier 1 medications, $50 for Tier 2 and Tier 4 medications, and $70 for Tier 3 and Tier 5 medications. Your emergency room copay is $250. Coinsurance is when you share in the cost for your medical services. After your deductible is met, your coinsurance will allow the plan to cover your costs at 90%. You cover 10%. This applies to most common services like physician visits, lab, x-ray, surgery, and hospital services. Coinsurance is new for 2020-2021, so please take note of this change. Some tips for your prescription drug. You can utilize mail order. After your deductible is met, you can get a 3-month supply of medication for only 2 copays. This is a cost savings and is convenient. A good idea for new medication is to know the price of the drug before you visit the pharmacy. You can obtain this information by calling your pharmacy or using the Priority Health Cost Estimator for your prescriptions. You can also utilize coupon savings programs like GoodRx. Visit goodrx.com and you might be eligible for a coupon that you can use for your prescription drug. After using your coupon, any out-of-pocket costs that you incur, you can submit to Priority Health with a claim form so that you can get credit on your deductible and towards your out-of-pocket limit. You can also search the web for manufacturer or copay assistance programs applicable to your specific medication. Again, remember to show your ID card. All services for your prescription drugs can accumulate towards your deductible or have a copay apply. This tells your pharmacist to bill Priority Health, and so you'll get credit for any out-of-pocket expenses for your deductible and your out-of-pocket limit. Your deductible, coinsurance, and any copays that you pay out of pocket all track towards your out-of-pocket limit. This caps your expenses each plan year. In-network, singles will never pay more than $3,000 per year. This is your $1,500 deductible and an additional $1,500 of copays and coinsurance. Doubles and families will never pay more than $6,000. This is your $3,000 deductible and $3,000 for copays and coinsurance. And just like the deductible, one person can meet your family out-of-pocket limit in full, or all family members combined can help to meet that limit. If you or your family reaches the out-of-pocket limit for the remainder of the plan year, all of your covered services are covered 100% until the plan year renews. As a reminder, you also have travel benefits. If you are outside of Michigan or outside of the Priority Health Service area, you have coverage in an emergency or for out-of-area dependents like college students. When you're outside of the service area, you'll utilize the Cigna network. Emergency care is covered in network anywhere that you might go. But if you have urgent care or general care that you need while you're out of the area, try to use the Cigna network to keep your out-of-pocket costs lower. You can visit Cigna.com to find a participating provider or see the back of your ID card. It lists a customer service number and information for your provider to help them bill Cigna when you're outside of Priority Health Service area. Reminder of some tools available from Priority Health to help you save on your out-of-pocket costs. You can use the Priority Health Cost Estimator to look for low-cost providers or lower-cost providers for certain services. You can even be rewarded if you use a green trophy provider. This is a low-cost, high-quality provider, and if you can utilize a provider that has the green trophy, you might be eligible for a gift card through Health Equity. Also, you can use the cost estimator for prescription drugs. You can utilize this service to know the cost of your drug before you fill it, or to potentially find a lower cost alternative. You can potentially use another brand name medication or a generic medication, and this tool will help you find different alternatives. You can even save money by simply switching pharmacies. This tool will also help you find the lowest cost pharmacy in your area. Another great tool is the Priority Health Spectrum Health Now. This is a virtual visit service that allows you to have a virtual or e-visit with a Spectrum Health physician. It's a great idea to download the Spectrum Health Now app ahead of time and register for their services. That way, when you need services quickly, you can log on and set an appointment for use. These services are available for minor medical conditions. Some of the examples are noted to the right on the screen. You can also utilize your own provider's e-services. Most hospital systems and a lot of doctors' offices offer virtual visits, especially in light of the COVID-19 situation. There's been a huge uptick in utilization of the e-visits. They are highly recommended and are easy and convenient and low cost, a great way to treat common illnesses. A great idea is to download the Priority Health mobile app. You can register for an account if you haven't already and have access to your medical claims, customer service information, the physician network, and again, set up a video visit and get virtual care. Next, we'll move on to the second component of your health plan, the health reimbursement arrangement. Your HRA is provided by Health Equity. The Health Reimbursement Arrangement, or HRA, partners with your health plan to provide a vehicle for Miller Johnson to help you pay for your healthcare expenses. This plan is designed for participants who are enrolled in Medicare and who are ineligible for the HSA. Miller Johnson will continue to fund your HRA. Withdrawals for your eligible expenses from your HRA are always tax-free. Miller Johnson is funding your HRA. Each plan year, Miller Johnson will continue to make a $1,000 lump sum deposit into your HRA account. Miller Johnson can make a $1,000 deposit available to you at the beginning of the plan year. Your deductible for single is $1,500 or $3,000 for family. This lump sum deposit can help offset your deductible expenses. However, you can also use your deductible for other expenses like copays, coinsurance, dental, and vision. Your HRA account is held by Health Equity. Keep in mind that your HRA does not roll over each year. If you don't spend your HRA dollars, they do expire at the end of each plan year. The full $1,000 is available to you beginning each September 1. You should have a debit card, and you can keep using the debit card that you have, as it will be reloaded at the beginning of each plan year. If you're a new participant to the medical and HRA, you will be getting a new debit card at the beginning of the plan year. You can also add money to your debit card by enrolling in flexible spending accounts. Your FSA will use the same debit card as your HRA. If you need additional debit cards for family members, you can request them online at healthequity.com or call the number on the back of your card and talk to member services. Items that are eligible to be used for your HRA are designated by the IRS. Generally, they include medically necessary medical, prescription, dental, and vision expenses for you and your IRS dependents. There's a full list at healthequity.com. You may be required to submit substantiation to Health Equity. For example, if you use your HRA debit card at Meijer to purchase medication or medical supplies, Health Equity may contact you to ask for a receipt or a provider billing. Please keep your receipts and your provider billings when you use your HRA in the event that this becomes necessary. When you want to use your account, simply submit or provide your Health Equity debit card to your provider, to a pharmacy, or use it to pay an invoice that you've received. You can also reimburse yourself online if you want to pay out of your own pocket for expenses and then later on be reimbursed by your HRA. You can upload a claim and submit a claim form as well. I highly recommend using the online account and the web tools provided by Health Equity. These tools are helpful online accounts, and they also have a handy mobile app. You can request reimbursement, you can see your transaction history, and you can use the educational tools to learn more about HRAs through their articles and videos. You can also link your personal bank account online. This is an awesome way to get a direct deposit reimbursement if you've paid out of pocket for your expenses. When you do your open enrollment, keep in mind that you don't have to enroll in your HRA. You're automatically enrolled. However, if you do want to submit additional funds via the flexible spending account, you do need to complete your open enrollment online through iSolved. If you've not done so already, make sure that you have a debit card and make sure that your debit card is activated. And again, we highly recommend that you register for an online account at Health Equity. You can also call or email Health Equity Member Services any time of the day. The number is noted here, as well as the email address, and you can also find those resources online and on the back of your debit card. As mentioned, if you're enrolled with an HRA, you can still also enroll for the full purpose medical flexible spending account. Keep in mind that this account does have some use it or lose it associated with it. However, you can roll over up to $500 to the next plan year if you've not exhausted all of your funds. Each year, you can elect to contribute up to $2,750 of additional funds. And remember, your HRA funds and your FSA funds are available for use through your one debit card. Thanks for joining us. If you have any questions, please reach out to Health Equity, Priority Health, or your Miller Johnson Human Resource Team. If you have a need that you'd like to contact me directly, you may do so by emailing me at kjohnson@lighthousegroup.net, or you may call me at 616-202-7003. Thank you.